Hello and welcome. We're about to tackle a subject that, let's be honest, can bring up a lot of worry and confusion, our breast health. My goal here is to give you a really clear, straightforward guide to some of the most common symptoms so you can better understand what your body might be trying to tell you. Let's dive right in. So here's our game plan. We're going to start with how to just listen to your body, then we'll get into the big three symptoms people worry about: pain, changes you can see like skin issues and swelling, and of course nipple discharge. And we'll wrap it all up with a super simple, actionable checklist.
You can think of what we're doing here as getting you your own personal toolkit for clarity. It's really all about giving you the knowledge to tell the difference between what's super common and what might actually be concerning. That way, you can feel way more confident about when you might need to chat with your doctor. Okay, first up, the single most common symptom of them all, breast pain. And let's just get the biggest fear out of the way immediately. The vast majority of the time, breast pain is not a sign of cancer. I mean, it is incredibly common. Seriously, if you've ever experienced this, you are so far from alone. The real key here isn't that you're having pain, but digging into what kind of pain it actually is.
So, here's the deal. There are basically two main types you need to know about. First, there's cyclical pain. You know, the kind that shows up around your period, usually affects both breasts. That's generally considered totally normal. But then there's focal, non-cyclical pain. That's different. It's a pain that's stuck in one specific spot, and it has nothing to do with your cycle. That's the one that might be worth getting checked out. All right, let's move on to symptoms you can actually see. Things like swelling or a weird change in skin texture can be pretty alarming, for sure. But just like with pain, the context is absolutely everything.
First, let's get a kind of strange-sounding term out of the way: peau d'orange. It's just French for skin of an orange, and it's a perfect description for what it is. Skin that gets thick and pitted, and it looks almost exactly like an orange peel. Go ahead and just lock that visual in your mind, because it's going to be important in a second. So you notice you have a swollen, red breast. What's going through your mind? Well, when doctors see this, the diagnosis usually boils down to two main possibilities. And the differences between them can be really clear. On one hand, you could have an infection, like mastitis. That's usually super painful, makes you feel really sick, and it's pretty common if you're breastfeeding. But on the other hand, you have something called inflammatory breast cancer, or IBC. And with that, it's often painless. The person can feel totally fine otherwise, and you guessed it, it often has that classic peau d'orange look we just talked about.
And this right here shows exactly why telling them apart is so critical. The treatment for IBC is totally different from most other breast cancers. You don't start with surgery. Instead, the whole idea is to cool down that inflammation first, using chemo or radiation before they ever do surgery.
Okay, moving on to our final big category: nipple discharge. And you know the drill by now. Let's start by tackling the #1 concern right away.
I mean, this is it, right? This is the first question on anyone's mind when this happens. Is this a sign of cancer?
And I've got some really reassuring news. About 90% of the time, the answer is no, it's not. The huge majority of nipple discharge cases are caused by totally benign, non-cancerous things. So, if most cases are benign, what are the things you should actually pay attention to? This right here. This is the phrase you need to remember. The combination of signs that's the most suspicious is when the discharge is spontaneous, meaning it just happens, you're not squeezing, when it's bloody, and when it's coming from just a single duct. Now, let's just quickly break down the most common causes. For premenopausal women, benign fibrocystic changes are super common. For postmenopausal women, a condition called ductal ectasia is often the culprit. And get this, the single most common cause of that scary-sounding bloody discharge is usually a tiny, non-cancerous growth called an intraductal papilloma. Now, a less common cause, but the one doctors are looking for, is something called DCIS, which is a non-invasive type of breast cancer.
And a really quick but important point: what if the discharge is milky? Well, that's not considered a red flag for breast cancer at all. It's usually tied to totally different things, like hormonal issues or maybe as a side effect from some medications.
So, we've walked through pain, we've talked about skin changes, and we've covered discharge. Now let's pull all of those key warning signs together into one final, easy-to-use checklist. All right, let's bring it all home. This is your time to see a doctor checklist. Any kind of skin dimpling or a specific spot that feels thick. A nipple that suddenly decides to turn inward. A swollen red breast that you've taken antibiotics for, but it's just not getting better. That peau d'orange skin texture we talked about. And finally, that specific type of nipple discharge, spontaneous, bloody, and from just one duct. At the end of the day, understanding these signs isn't about making you feel scared, it's about empowering you with clarity. Your best tool for your own health is knowledge. So the real question to leave you with is, are you listening to what your body is telling you? Thanks so much for joining me.